Okay, A to Z of emergency medicine. C is for Clevidipine. It's not one that we use a ton right now in the emergency department, but the reason I want to mention it is because it is now on the stroke guidelines, in the stroke guidelines for management of blood pressure before, after, or during thrombolytics for acute ischemic stroke. And while ED providers aren't completely on board with it for blood pressure management, Neuro IR loves it because it has really tight management of blood pressure. There's a few things pharmacists will nerd out about in that it has linear management of blood pressure. And what I mean by that is if you start it at 2 milligrams per hour and it lowers blood pressure by 10 millimeters of mercury, and then you increase it to 4 milligrams per hour, so you double the dose, you will get a linear decrease in blood pressure. So if 2 milligrams per hour lowers your blood pressure by 10 millimeters of mercury, 4 milligrams per hour will lower your blood pressure by 20 millimeters of mercury. So you get a really tight and exact and measurable, predictable decrease in blood pressure, which sounds great, right? You know, the nerd in me loves that, but nicardipine lowers blood pressure too. And there are very few scenarios where that type of tight blood pressure is really necessary. But one of those scenarios is when you have a catheter in somebody's brain, and that's why Neuro IR loves it. At this point, we're not using it in the ED. We're still okay with nicardipine, but they're oftentimes switching patients over to Clevidipine when they get to IR. And so I think in the near future, we may see patients started on Clevidipine in the ED prior to going over to IR. And that's why I mention it. The other thing is there's not a lot of compatibility data with Y-site compatibility. It is a lipid emulsion. It looks like propofol. It's white. And so there are some other things to consider when using it. For now, we're still using a lot of nicardipine, and that's totally fine, but I wanted to mention it because I do think it might be something that we see in the future. So C is for Clevidipine. Pharm ER.